Hi everyone, I'm Dr. Funke Afolabi Brown. I am the founder of Restful Sleep MD, where we help parents, especially busy moms, prioritize sleep in their children and in themselves as well. So today I wanted to talk about a very important condition that is seen in children, and that is obstructive sleep apnea. I know most of the time when you talk about obstructive sleep apnea, the first thing that comes to mind is, older male snoring very loudly, the house is vibrating and things like that. But children do have obstructive sleep apnea or sleep apnea, and they can have it frequently. And it's something that we have to address because it can disrupt their sleep and can cause a lot of daytime consequences that we really want to avoid. So what is obstructive sleep apnea? Obstructive sleep apnea is essentially repeated episodes of upper airway obstruction or closure. So closure of your upper airway around your throat region. And what can happen then is when you're going into sleep and you have this partial or complete upper airway closure, then you can imagine that that can affect the way your body gets oxygen and gets rid of carbon dioxide. The other thing that obstructive sleep apnea can do is that it can fragment your sleep or your child's sleep. And so over the course of the night, every time the child goes to sleep, the throat closes and then, wakes up gasping or choking and then tries to continue sleep. So essentially their brain is awake during the course of the night. And so they wake up in the morning and still feel tired because they've really not been able to achieve restful sleep. So what are the different symptoms that you can see in sleep apnea in children? There's a very wide number of ways children with sleep apnea can present. And that's why some time ago I had posted on social media about snoring in a child may not necessarily be normal. So if your child is snoring, that's something to pay attention to, especially if their snoring is what you call habitual, meaning that they're snoring more than 2 or 3 times a week and they're snoring outside of colds. So in terms of the symptoms, snoring is something that you may see frequently. In some children, you may not necessarily hear very loud snoring. So this is something you have to pay attention to. And so other symptoms I would group into nighttime symptoms and daytime symptoms. So the nighttime symptoms of sleep apnea include the snoring, choking during sleep or gasping, difficulty breathing where they're breathing heavy during sleep, very restless sleep where they're tossing and turning. Some children may sweat very excessively. And also some children also may have bedwetting. And this is not bedwetting that you would see in a child who is not necessarily dry, but essentially what we call secondary enuresis. And what that is that your child has been dry, they're already, potty trained, they're already dry during the night, and all of a sudden, they start bedwetting again. So that's something that you may see that may clue you in, maybe in addition to snoring or some of the other symptoms, that maybe there is a component of sleep apnea. In terms of the daytime symptoms, one of the things I see frequently is a lot of daytime tiredness. Sometimes they may be sleepy during the day. Interestingly enough, you may see the opposite, where the child is not sleepy, they're actually hyperactive. They may have difficulty with paying attention, with really poor concentration. Our older children may be moody, or, the younger ones may throw more tantrums. They may have difficulty with growth. Remember, one of the benefits of restful sleep is good growth, is growth in children. So they may have growth issues where they may have difficulty gaining weight and things like that. Sometimes they may have frequent colds, constant nasal congestion, or they may also wake up sometimes with headaches in the morning, especially the older ones. So you can see there are quite a number of symptoms that you may have in a child that has sleep apnea. So it's important to pay attention to it. In terms of the age range, you can have obstructive sleep apnea in really, really young children, especially children that may have other issues like what we call facial abnormalities or syndromes, or Down syndrome especially, or Prader-Willi syndrome. Those are some things you may see. And you can see it also in adolescence all the way to adulthood. So it's the whole age spectrum can be affected by obstructive sleep apnea. So in my subsequent videos, I'm going to tell you about how to diagnose it. Usually you do need a sleep study, as well as how to treat it. Usually it involves, it may involve surgery or CPAP or some other treatment. So we'll talk about that in other videos. But the important thing is, if your child has any of the symptoms I have listed, where they're snoring habitually more than 3 times a week, outside of colds, and they have any of the symptoms that I discussed, then you definitely want to talk to the pediatrician, who would take a history, examine very carefully, may refer you to get a sleep test done or to see the ear, nose, and throat doctor. I hope this has been helpful. I just really want to create this awareness, and I need your help to do that. So subscribe to my channel, share this video, like and comment, so that we could get the word out there. Because when our kids sleep better, then we do as well. And so I'll see you next time.